When I run into people on yachts or meet with people at expensive spas, there are generally three ways people get their money. They either work in finance, their parents are filthy rich, or they're doctors. Sometimes the doctors are the richest of them all. There are hundreds of specialty doctors out there who are millionaires, partially because there are so few experts in their particular field. Today, we're going to take a look at the 10 highest paid specialists and see exactly how much they make. Number 10. Oncology. Being a doctor is an emotional gig. You're often seeing patients at their most vulnerable and giving them information that is heartbreaking, scary, and downright confusing. When you're an oncologist, that's almost every single appointment you have. Oncologists are doctors who specialize in treating cancer. Though the job is tough and the hours are long, according to Merritt Hawkins, their average salary is $393,000 per year. There are three main types of oncologists: a medical oncologist who uses chemotherapy, targeted medications, or immunotherapy, a radiation oncologist who uses radiation, and a surgical oncologist who performs biopsies and surgery. To be an oncologist and make that amazing salary, it's not an easy road, and you're going to be using that salary to pay off a lot of student loan debt. Oncologists need a 4-year bachelor's degree and a 4-year medical school degree and 2 to 4 years of working in a residency or fellowship program. Number 9. Pulmonology. Breathing is pretty important, and because of that, pulmonologists are too. Pulmonologists are specialists who focus on diseases that affect the respiratory tract, like, say, some disease that causes fever, a dry cough, and pneumonia, and they earn quite a good amount of money doing it. On average, pulmonologists earn about $399,000 per year. You could say they can breathe easy with that kind of money in their bank account, I'm sure. But it's not all smooth sailing and easy breathing to become a pulmonologist. You must earn a 4-year bachelor's degree, complete a 4-year medical program, a 3-year specialist training program, and then a 2 to 3 year fellowship, which adds up to about 12 years total. When they've completed schooling and are working their way up to that large salary, pulmonologists often work in intensive care and treat complex diseases of the lungs and chest. Number 8. Otolaryngologist. Have you ever heard of an otolaryngologist? Me neither, but I can almost guarantee you've heard of an ENT, and they're the exact same thing. That's right. Ear, nose, and throat doctors make the big bucks, about $402,000 per year, and they probably should make that money. ENTs have to go to a whopping 15 years of schooling, and they're specialists that must always be trained in surgery as well. After their bachelor's, medical school, and 5 years of specialty training, ENTs must pass the American Board of Otolaryngology exam and then do another 2 years of training. I have a feeling that most ENTs didn't have a lot of time to party in college. ENTs don't only deal with the ear, nose, and throat. They also have to deal with the head and neck and be trained to do surgery on all of the above. In other words, they're busy doctors. Number 7. Anesthesiologist. One of the greatest things about modern medicine is that we don't have to feel pain during procedures. There's no more downing a bottle of whiskey on the battlefield while Hank from down the street takes a saw to you. We've got a lot more safety and comfort at our disposal now. One of the big reasons for that is because anesthesiologists exist, and they make an average of $404,000 per year. Anesthesiologists are in charge of making sure patients don't feel pain before, during, and after surgery. Slapping a mask on someone's face and counting to 10 may seem pretty simple, but in reality, an anesthesiologist is in charge of much more than that. Before surgery, they determine the correct mix of medication to use to treat pain in the days or hours of waiting, and the correct mix for the surgery itself. During the surgery, anesthesiologists stand by, ensuring that the patient is unconscious and feeling no excruciating pain while they're being worked on. No sweat, right? Needless to say, the job is a high-stress position, but before anesthesiologists can even land the high-stress job, they've got to go through some intense schooling. A 4 years bachelor's degree, 4 years of medical school, and then 4 years of working in an anesthesia residency program means they spend a total of at least 12 years hitting the books. Number 6. Dermatologist. In 2019, 1.22 million Americans spent more than $500 on skincare over the course of the year. People care a lot about having clear skin, and that's a part of the reason reason that dermatologists make $420,000 a year. Dermatologists are doctors that focus on diseases and the care of skin, hair, and nails, and mucous membranes. They can treat over 3,000 different conditions, and though many people go to them for acne, they also are the primary doctor to help treat and diagnose things like skin cancer. They're also the doctors that you see all over the internet popping pimples on Instagram. To be a dermatologist, you'll have to complete at least 12 years of schooling. Number 5. Non-invasive cardiologists. Non-invasive cardiologists come in at number 5 on my list, with an average salary of $441,000 per year. Not too bad for not even having to pick up a scalpel, huh? As the name implies, non-invasive cardiologists are doctors who treat, diagnose, and prevent diseases of the heart using non-invasive methods. They can provide outpatient services and inpatient services, depending on the severity of the patient's condition. They do this by running stress tests, echocardiograms, and CTAs. But it isn't easy schooling just because a little less blood is involved. Non-invasive cardiologists must attend around 14 years of school, with countless tests to get their certification. Number 4. Urologist. When you hear urologists, chances are one thing comes to mind, and it might be hard to imagine that they're making a whopping $464,000 per year on average for analyzing pee in a cup. However, urologists have a much bigger job description than many people realize. Yes, urologists do deal with the urinary tract, but they're also experts in your kidneys, bladders, and, if you've got it, the male reproductive system. To do this, they've got to get a 4 years bachelor's degree, attend 4 years of medical school, and then do another 5 years of specialty training. Once urologists have earned all their certifications, they can choose a specialty area that they'd like to focus on. Number 3. Gastroenterologist. If you've got tummy troubles, a bad liver, or even problems with your tongue, you're going to the same doctor, a gastroenterologist. They have a lot of body parts and systems they needed to be educated on, which is part of the reason why they earn $495,000 per year. Gastroenterologists deal with the diseases that can be found within the GI tract, and since that system is so complex, they're required to be experts on several different organs. Gastroenterologists perform endoscopies and colonoscopies, but they don't perform any invasive surgeries. They must attend 14 years of schooling before they can take their specialty certification exam and start practicing. Number 2. Orthopedic Surgeons. Orthopedic surgeons have become one of the highest paid doctors in the world, and it's partially because every team in the NBA and NFL has their own on standby. On average, orthopedic surgeons make $536,000 per year. In general, they are doctors who specialize in bones, muscles, ligaments, tendons, and joints, so I'm sure you can imagine why they're sitting courtside at the games. Many orthopedic surgeons choose one area they'd like to specialize in, such as the hip, knee, feet, or hands. They perform orthopedic surgeries such as knee replacements, soft tissue repair, joint surgery, and bone fragment repair. The majority of surgeries they perform now are outpatient surgeries. Unfortunately for orthopedic surgeons, they certainly can't afford to be lazy bones in college. 15 years of schooling is required, and they have to pass a rigorous testing system to even begin their residency. Number 1. Invasive Cardiologists. The highest paid doctors in the United States, on average, are invasive cardiologists, who make a startling $648,000 per year. For perspective, that's more than 1.5 times what the President of the United States makes in office. That being said, the President isn't performing life or death surgeries like invasive cardiologists do. Their main role is treating heart conditions that are caused by structural or electrical issues within the heart. They can insert stents, perform angioplasty, and insert catheters. Naturally, dealing with the heart requires lengthy schooling, just like every other job on my list. They must attend at least 14 years of higher education to receive their certification. Even after that, it isn't smooth sailing. Due to the nature of the job, 60% of invasive cardiologists will be named in a malpractice lawsuit in their lives, and that comes with a lot of stress. So, there you have it, the 10 highest paid specialties in the medical world. Are you an aspiring doctor? And do you think all these jobs are worth the stress? Let me know in the comment section down below. If you enjoyed the video, make sure to leave a like, subscribe, and turn on post notifications. As always, I'm Mr. Luxury. Pip pip de doodly doo.